Struggling with poor blood flow, blocked veins, or weak erections isn't just frustrating, it's a major warning sign in diabetes. If you've noticed numbness, slow recovery, or circulation issues, this could change everything for you. Welcome to Diabetic Health. Today we're uncovering what's really behind clogged veins down there and how your blood sugar, nerve health, and circulation all play a role. No gimmicks, just real, natural ways to support your body's repair and restore flow where it counts most. Stick around for the three best vitamins that help restore circulation. And stick around because after that, we'll explain how dark chocolate helps and how lifestyle affects your genes and how vitamins can heal the harm. Let's begin with number one. Vitamin number one, methylcobalamin. Methylcobalamin is essential for repairing nerve damage caused by diabetes, especially in the small nerves controlling blood vessel dilation in the penis. When these nerves are damaged, arteries and veins lose their ability to properly relax and contract, leading to poor blood flow and erectile difficulties. Methylcobalamin aids in the regeneration of the myelin sheath around nerves, speeding up nerve signal transmission and restoring muscle control in penile vessels. This restoration is critical because without proper nerve signaling, veins cannot open fully, causing blood to pool and veins to become clogged. Clinical observations show that after consistent supplementation, diabetic patients report improved nerve sensitivity and stronger erections due to better vessel responsiveness. Unlike general antioxidants, methylcobalamin uniquely lowers homocysteine levels, a toxic amino acid that contributes to arterial stiffness and plaque formation. Elevated homocysteine disrupts the inner lining of arteries, including those supplying the penis, leading to microvascular damage and narrowing. By reducing homocysteine, methylcobalamin protects endothelial cells from injury and supports nitric oxide production, which directly causes vasodilation. This combination prevents further narrowing and initiates the repair of clogged penile veins by enhancing elasticity and reducing early atherosclerotic plaques that impede blood flow. Studies have shown a 20 to 30% reduction in homocysteine within weeks of methylcobalamin supplementation, which correlates with improved peripheral blood flow. Methylcobalamin's role in red blood cell formation improves oxygen delivery to tissues suffering from hypoxia, a common problem in diabetic penile tissue. Poor oxygen supply weakens vascular walls and slows repair processes, allowing blockages to worsen. By supporting healthy blood cell production, methylcobalamin ensures that oxygen carrying capacity is optimized, which boosts cellular metabolism and accelerates the removal of waste products from clogged veins. This improved oxygenation also enhances mitochondrial function within endothelial cells, increasing energy availability required to maintain open, unclogged vessels. Oxygen-rich tissues resist fibrosis and scarring, which are common complications that worsen venous constriction in diabetes. In insulin resistance, chronic inflammation damages blood vessels and promotes fat accumulation within arterial walls, contributing to plaque buildup that restricts blood flow to the penis. Methylcobalamin improves insulin sensitivity by enhancing mitochondrial energy metabolism, which lowers cellular stress and reduces inflammatory cytokines. This metabolic optimization not only prevents new blockages from forming, but also supports the breakdown of existing plaques. Enhanced insulin function indirectly helps unclog veins by stabilizing blood sugar levels, which decreases oxidative stress and inflammation around penile arteries. Research indicates that improved insulin sensitivity after methylcobalamin use leads to measurable reductions in markers of vascular inflammation, promoting better blood flow. Cholesterol balance is vital for vascular health, especially in diabetes, where LDL cholesterol often accumulates in artery walls causing plaque formation. Methylcobalamin indirectly supports cholesterol metabolism by improving liver function and reducing systemic inflammation, which helps maintain healthy HDL levels that remove excess cholesterol from blood vessels. This action prevents further buildup inside penile arteries and veins, reducing blockages that impair erectile function. Studies have linked methylcobalamin with decreased LDL oxidation, a key step in atherosclerosis development, highlighting its role in maintaining clear and flexible penile veins necessary for healthy blood flow. Fertility and libido depend on a complex interplay between hormone levels, nerve signaling, and vascular health. Methylcobalamin enhances dopamine production, which elevates sexual desire and protects sperm DNA from oxidative damage caused by poor circulation and high blood sugar. When penile veins and arteries are clogged, oxygen and nutrients fail to reach reproductive tissues efficiently, lowering sperm quality and reducing libido. By restoring vascular health through anti-inflammatory and nerve-supporting actions, methylcobalamin indirectly supports hormonal balance in sperm production. Clinical evidence links improved vascular function from methylcobalamin supplementation with increases in sperm motility and count in diabetic men over several months. The timing and quality of erections rely heavily on rapid, coordinated nerve signals and sufficient blood flow. Methylcobalamin improves nerve conduction velocity by repairing nerve sheath damage, which enables faster muscle responses in the penile vasculature. Simultaneously, better blood flow through unclogged veins maintains pressure in the erectile tissue for longer durations. This combined effect results in more natural erection timing and reduces premature ejaculation caused by nerve and vascular dysfunction. Patient reports and electrophysiological studies show enhanced peripheral nerve conduction after methylcobalamin therapy, which correlates with improved erectile response times. Natural sources of methylcobalamin include animal-based foods such as red meat, liver, fish, eggs, and dairy products. However, diabetics, particularly those on metformin, often face deficiencies due to impaired absorption, making supplementation necessary for therapeutic benefits. Supplements usually come as sublingual tablets or injections, which bypass digestive issues and ensure higher bioavailability. The recommended daily intake for vascular and nerve repair ranges between 1,000 to 5,000 micrograms, depending on severity. Consistent use over at least 3 to 6 months is necessary to see significant improvement in unclogging penile veins and restoring erectile function. Long-term supplementation combined with blood sugar control and lifestyle changes offers the best chance for reversing diabetic vascular complications affecting sexual health. If you like this video up till now, please subscribe to this channel to help us grow. Now let's move on to the number 2. Vitamin number 2, vitamin D. Vitamin D deficiency has a direct impact on insulin resistance by disrupting the signaling pathways that regulate glucose uptake in muscle and fat cells. When vitamin D levels are low, these cells respond less effectively to insulin, leading to higher blood sugar levels that damage delicate penile microvasculature. This damage narrows the small veins and arteries in the penis, reducing the capacity for blood to flow freely. Adequate vitamin D helps restore these signaling mechanisms, which improves blood sugar management and lessens the vascular strain that contributes to the clogging of penile veins.
Apart from blood
Beyond
vessels,
blood
your
sugar
kidneys are essential
control,
organs that maintain the health
vitamin
of your entire
D
body.
influences the balance of
The term
calcium
quiet
and
victims is
vascular
frequently
smooth
used to
muscle
refer to them
cells,
because they can exhibit
which affects blood vessel tone and elasticity. Calcium overload in these cells can cause excessive contraction and stiffness, raising vascular tension and contributing to impaired penile blood flow. Vitamin D modulates calcium channels and promotes relaxation of these muscles, allowing the veins to remain pliable and resist narrowing. This action is critical in diabetics, where high vascular tension compounds the risk of erectile dysfunction by limiting the vein's ability to expand and drain blood efficiently. Vitamin D also plays an essential role in managing cholesterol metabolism by regulating the synthesis of bile acids in the liver. This regulation helps reduce the accumulation of cholesterol in the bloodstream and prevents its deposition in the walls of penile arteries. Additionally, vitamin D enhances the expression of genes responsible for cholesterol efflux, the process by which excess cholesterol is removed from cells. By maintaining this balance, vitamin D lowers the risk of atherosclerotic plaque formation that contributes to the clogging of penile veins, thus supporting healthier vascular flow necessary for erection. Creatinine elevation, often a sign of kidney stress or dysfunction in diabetes, correlates with impaired removal of waste products and excess fluids, which increases blood volume and pressure in vessels. Vitamin D contributes to kidney health by regulating the activity of the parathyroid hormone, which in turn influences fluid balance and electrolyte homeostasis. Improved kidney function, supported by sufficient vitamin D, helps reduce vascular overload and prevents increased tension in penile veins, assisting in the maintenance of clear, unclogged blood vessels vital for erectile performance. Cellular aging accelerates due to chronic inflammation and oxidative damage in diabetes, which breaks down collagen and elastin fibers that keep blood vessels flexible. Vitamin D activates multiple anti-inflammatory pathways and enhances the production of protective molecules, such as glutathione, reducing oxidative stress in penile endothelial cells. This protective environment slows down fibrosis and calcification in veins, preserving their structure and function. By maintaining youthful vascular tissue, vitamin D prevents stiffness and blockage in penile veins, improving overall erectile capacity. The hormone-regulating properties of vitamin D extend to the hypothalamic pituitary gonadal axis, which controls testosterone synthesis. Deficiency in vitamin D is linked to lower testosterone levels, contributing to decreased libido and fertility problems. By normalizing vitamin D levels, testosterone production improves, which enhances sexual desire and sperm quality. Improved penile blood flow due to better vein health synergizes with hormonal balance, optimizing fertility outcomes and supporting sustained libido in diabetic men. Vitamin D influences the neuromuscular junctions that control penile erection by promoting the synthesis of neurotransmitters, such as acetylcholine, which are crucial for muscle relaxation in the penile vasculature. This biochemical support improves the timing and strength of erections, ensuring that penile veins dilate and constrict appropriately during sexual arousal. Enhanced neuromuscular coordination reduces the risk of delayed or insufficient erections, which are common in diabetic vascular and nerve complications. Natural vitamin D mainly comes from sunlight exposure and foods like cod liver oil, fortified cereals, and UV-exposed mushrooms. But many diabetics have limited sun exposure or impaired skin synthesis, making supplementation important. Vitamin D3 supplements are preferred over other forms because they are better absorbed, stay longer in the body, and more effectively raise and maintain active vitamin D levels needed for vascular and reproductive health. Adequate vitamin D supports the regulation of blood vessel tone and reduces inflammation, which helps prevent the stiffening and clogging of penile veins common in diabetes. Typical daily doses range from 2,000 to 5,000 IU, and consistent use over 3 to 6 months is usually required to see improvements in penile vein health, insulin sensitivity, and erectile function. Maintaining these optimal levels long-term supports ongoing repair of blood vessels, improves endothelial function, and helps prevent future vascular problems related to diabetes. What if a simple antioxidant could protect your arteries from diabetic damage? Vitamin E, especially its potent gamma-tocopherol form, doesn't just fight oxidation, it repairs the inner lining of blood vessels, revitalizing blood flow and gradually clearing clogged penile veins in diabetics. Let's move on to number 3 to give you the science-backed answer on this number 3. Vitamin number 3, vitamin E. Vitamin E, especially in its gamma-tocopherol form, serves as a potent antioxidant that protects blood vessels from oxidative damage caused by free radicals, which are particularly elevated in diabetic conditions. This oxidative stress accelerates the formation of plaques in penile arteries, contributing to atherosclerosis and vessel clogging. By neutralizing these harmful molecules, vitamin E slows down the progression of arterial stiffening and preserves the integrity of penile veins, ensuring smoother blood flow essential for maintaining erections. The role of vitamin E extends to enhancing the production of nitric oxide in endothelial cells lining the blood vessels. Nitric oxide is a vital molecule that triggers relaxation of vascular smooth muscles, allowing arteries and veins in the penis to dilate properly during sexual arousal. Improved endothelial function directly translates to better blood flow and reduced vascular resistance, which prevents the pooling and congestion in penile veins that lead to erectile difficulties. Unlike some antioxidants, vitamin E specifically boosts this vasodilatory pathway, making it crucial for vascular health in diabetics. Vitamin E also supports the stability of red blood cells, protecting them from oxidative damage and prolonging their lifespan. This effect ensures efficient oxygen delivery to penile tissues, which is critical because hypoxic conditions promote inflammation and fibrosis in blood vessel walls. By maintaining a healthier population of red blood cells, vitamin E indirectly reduces cellular aging and stress in penile vasculature, which otherwise contributes to vein stiffness and impaired blood flow. In the context of cholesterol management, vitamin E prevents the oxidation of low-density lipoprotein, LDL particles. Oxidized LDL is a key factor in the initiation and progression of plaque formation within arteries. By blocking this oxidative modification, vitamin E reduces lipid buildup in penile arteries and veins, lowering the risk of blockages that interfere with normal erectile function. This antioxidant property helps maintain flexible and unclogged blood vessels necessary for sustaining an erection. Vitamin E's anti-inflammatory effects also extend to reducing vascular inflammation associated with elevated blood sugar levels. Chronic inflammation thickens arterial walls and reduces their elasticity, impairing blood flow to the penis. By modulating inflammatory cytokines and decreasing endothelial cell activation, vitamin E promotes a healthier vascular environment where veins can function without excessive constriction or blockage, which improves erectile quality and duration. The vitamin also plays a role in supporting immune system regulation, which is important in preventing microvascular complications in diabetes. A well-regulated immune response avoids excessive damage to blood vessels caused by immune cell infiltration and oxidative stress. This protection preserves the microcirculation in penile tissues, supporting both fertility and libido by ensuring consistent nutrient and hormone delivery necessary for reproductive function. Vitamin E influences hormonal balance by protecting the Leydig cells in the testes, which produce testosterone. Oxidative stress damages these cells, leading to reduced testosterone synthesis, which negatively impacts libido and fertility. By reducing oxidative damage, vitamin E supports sustained testosterone levels, which combine with improved penile vascular health. Regarding the timing and quality of erections, vitamin E contributes to improved muscle relaxation and nerve signaling in the penile vasculature by protecting the lipid membranes of nerve cells from oxidative injury. This results in faster nerve impulse transmission and more coordinated vascular responses during sexual stimulation, supporting stronger and longer-lasting erections without premature loss of rigidity. Natural sources of vitamin E include nuts such as almonds and hazelnuts, seeds like sunflower and pumpkin seeds, green leafy vegetables such as spinach, and oils like sunflower and safflower oil. For diabetics facing higher oxidative stress, mixed tocopherol supplements, especially those rich in gamma-tocopherol, may be necessary to reach effective doses. Mixed tocopherol supplements are preferred because they provide a broader spectrum of vitamin E forms, including alpha, gamma, and delta tocopherols, which work together synergistically to offer more comprehensive antioxidant protection. Gamma tocopherol, in particular, is more effective at neutralizing certain reactive nitrogen species that contribute to inflammation and vascular damage in diabetes. Daily intake of 200 to 400 IU over a period of 3 to 6 months has been shown to improve vascular function and reduce oxidative damage in diabetic blood vessels, contributing to the gradual unclogging of penile veins and enhanced erectile function. Consistent supplementation alongside blood sugar management in a healthy lifestyle is key for long-term benefits. Now we'll see how the compounds in dark chocolate assist in reducing penile vein congestion. Dark chocolate, especially varieties with high cocoa content, 70% or more, contains potent compounds called flavanols that have a significant impact on vascular health, which is particularly beneficial for diabetics struggling with clogged penile veins. Flavanols help stimulate the production of nitric oxide, NO, in the endothelial cells lining blood vessels. Nitric oxide is a crucial molecule that signals blood vessels to relax and widen, improving blood flow. In diabetes, endothelial dysfunction often reduces nitric oxide availability, leading to stiff, narrow arteries and veins that restrict blood flow. By boosting nitric oxide, the flavanols in dark chocolate help restore proper vessel dilation, reducing the resistance within penile veins and arteries, thereby supporting better erectile function and reversing some of the damage caused by chronic high blood sugar. Consuming about 20 to 30 grams of high cocoa, 70% or higher, Dark chocolate daily has been shown to provide meaningful vascular benefits without adding excessive calories or sugar. Clinical studies suggest that consistent intake over a period of 6 to 12 weeks can lead to measurable improvements in endothelial function and arterial flexibility, which are essential for unclogging penile veins and improving blood flow. It's important that the dark chocolate chosen is low in added sugars and fats to avoid negative effects on blood sugar control, especially for diabetics. Combining this dietary approach with proper blood sugar management and a healthy lifestyle amplifies the benefits. Now we uncover how lifestyle alters genes that affect veins and how vitamins help fix the damage. Diabetes and poor lifestyle habits, such as unhealthy diet, smoking, and chronic stress can trigger epigenetic modifications, chemical changes on DNA that alter gene activity without changing the genetic code itself. These changes can switch off genes responsible for maintaining healthy blood vessels or turn on genes that promote inflammation and fibrosis in arteries and veins. Over time, this dysregulation leads to stiffening, narrowing, and clogging of blood vessels, including those in the penis, contributing to erectile dysfunction and reduced blood flow. Epigenetic changes also impair the repair mechanisms of vascular cells, making it difficult for damaged veins to recover and reopen naturally. This creates a vicious cycle where ongoing gene dysregulation worsens vascular health and complicates diabetic complications. Vitamins play a crucial role in influencing these epigenetic mechanisms by providing the necessary cofactors and substrates for enzymes that add or remove chemical tags on DNA and histones, the proteins around which DNA wins. For example, vitamins involved in methylation processes, such as B12 and folate, help restore normal gene expression by correcting harmful methylation patterns that silence protective genes. Antioxidant vitamins reduce oxidative stress, which is a major driver of adverse epigenetic changes, thereby preventing further gene damage. Through these actions, vitamins support the reactivation of genes that promote blood vessel flexibility, reduce inflammation, and enhance endothelial repair. This epigenetic modulation helps diabetic patients gradually reverse vascular dysfunction, unclog penile veins, and improve overall blood flow, even when genetic predispositions or past damage exist. Thanks for watching. Have you tried any vitamins or natural remedies to support your vascular health? Drop your experience in the comments below. I'd love to hear from you. If you found this helpful, please like the video and subscribe for more tips on managing diabetes and improving your health. Also, check out our other videos for more helpful advice. Stay healthy and see you next time.